Most seniors believe that routine medical checkups are a safety net, a shield that keeps them protected as they age. Every year, millions over the age of 70 walk into clinics with faith that every scan, every lab test, and every procedure is guiding them toward longer, healthier lives. But there's a reality very few people talk about. Not your doctor, not your insurance provider, and not the clinics who run these tests day in and day out. A growing body of research is uncovering that certain medical checkups, especially the routine ones that are pushed automatically after a certain age, may cause more harm than healing. Yes, the very tests meant to protect seniors can sometimes set off a chain reaction of unnecessary treatments, fear-driven decisions, and side effects that alter life quality in ways no one expects. What if I told you that many of these checkups don't lead to better health outcomes, but instead lead to worry, overdiagnosis, and complications that could have been avoided entirely? Studies in older adults now suggest that over 1/3 of screenings routinely offered to seniors result in unnecessary follow-ups, medications, or procedures. And here's the truly unsettling part. Most seniors don't even realize they're being over-tested. Doctors rarely explain how age changes the usefulness of certain scans. A test that made sense at age 50 may offer almost zero benefit at age 75, but still carries risks. And because aging naturally brings changes in the body, many scans detect abnormalities that are actually harmless. But once something shows up on a test, even if it's insignificant, the medical system tends to chase it. More tests, more referrals, more procedures, more stress. You are about to learn the 5 checkups that experts warn should be reconsidered or avoided entirely after age 70. These tests are often presented as routine, harmless, or preventive, but in reality, they can quietly push seniors toward aggressive treatments, surgeries, or lifelong side effects that provide little meaningful benefit. What's even more surprising is that one of these checkups is now believed to contribute to up to 5% of all cancers in the United States, putting it almost on the same danger level as daily alcohol consumption. Yet almost no patient is warned about this before agreeing to the scan. This video isn't about fear, it's about empowerment. When you understand which tests are useful and which may put your health at risk, you gain control, you gain clarity, and you become an informed partner in your own medical journey. Before we dive into the list, I want to know, where are you watching from? How old are you? And have you ever gone through a test or procedure that you later realized wasn't necessary? Share your story in the comments. We read every single one and respond with personalized guidance. Now, let's begin with checkup number 5, a test that looks completely harmless, but can quietly damage your quality of life. On the surface, the bone density scan, often called a DEXA scan, seems harmless. It's quick, painless, and doesn't require needles, fasting, or any preparation. Most seniors think of it as a simple way to check their bones, especially because osteoporosis becomes more common with age. But here's the part that rarely gets discussed. After the age of 70, this test can cause more anxiety, confusion, and unnecessary treatment than it prevents. A DEXA scan measures how dense or strong your bones are. But what it doesn't tell you is equally important. Bone density naturally decreases with age, the same way we get fine lines on our skin or gray strands in our hair. It's part of the human experience, not automatically a medical crisis. Yet for seniors, the slightest dip in bone density often results in a diagnosis like osteopenia, mild bone loss, or even borderline osteoporosis. Once you receive such a label, it's incredibly easy to get pushed toward medications that come with risks nobody warns you about. One of the most commonly prescribed groups of medications is bisphosphonates, which are intended to strengthen bones. But they can trigger side effects such as chronic heartburn, painful inflammation in the esophagus, and in rare but devastating cases, jawbone deterioration. Imagine going in for a simple scan and coming out months later dealing with lifelong dental or digestive problems, all because of a treatment you may not have needed. Scientific evidence is beginning to show that treating mild bone loss in people over 70 has very little effect on actual fracture prevention. In fact, one large study following older women for several years found that medications used to treat minor density loss resulted in less than 1% improvement in fracture risk. Meanwhile, the number of people who experienced side effects or complications from these drugs was significantly higher. Let me introduce you to Clara, a 78-year-old gardener who loved tending to her backyard roses. After her annual physical, she was encouraged to get a bone density scan. The results showed mild osteopenia, nothing alarming, but her doctor prescribed a bisphosphonate just to be safe. Within weeks, Clara developed severe acid reflux and sharp jaw discomfort. She stopped gardening, stopped eating certain foods, and became fearful that something was seriously wrong. When she visited a specialist, she learned that her bone loss was normal for her age and didn't require medication at all. After stopping the drug and starting a routine of gentle strength training, vitamin D, and calcium-rich meals, she regained her comfort and mobility. The truth is simple. For active seniors who haven't had recent fractures or repeated falls, lifestyle often does more for bone strength than medication ever will. Weight-bearing exercises, resistance bands, balance training, sunshine exposure, and a nutrient-rich diet all play a bigger role in preventing fractures than a number on a scan. So before agreeing to a bone density scan after 70, ask your doctor, if this test finds mild bone loss, what happens next? Because sometimes the safest choice is to skip the scan altogether. Up next, checkup number 4. And this one has pushed thousands of seniors into unnecessary fear and even surgery. When someone over 70 begins forgetting names, misplacing items, or losing track of conversations, the first emotion that rises is fear. Fear of dementia, fear of Alzheimer's, fear of losing independence. Families panic, seniors panic, and doctors often respond with one immediate recommendation: let's do a brain MRI. It sounds logical. An MRI feels like a high-tech way to get clarity. But here's the truth very few seniors ever hear. For mild memory changes, brain MRIs almost never give helpful answers, and they frequently cause unnecessary fear. A brain MRI is designed to show detailed images of the brain's structure, but aging itself naturally causes certain changes. Nearly every MRI of a person over 70 will show some combination of mild shrinkage, harmless white spots, age-related thinning, small vessel changes. These findings are usually normal, not signs of disease. But once a report says abnormality, patients assume something is seriously wrong. Even small, harmless details can spiral into worry. Research shows that in adults over 70 with mild forgetfulness, more than 80% of MRI scans reveal findings that are age-appropriate and harmless, while only a tiny percentage point to something treatable. Yet, the emotional toll is huge. Many seniors stop driving, stop socializing, or assume they are deteriorating, all because of a normal aging change shown on a frightening medical report. Even worse, unclear MRI. Results often trigger a chain of additional tests, such as spinal taps, repeat scans, neurologist referrals, experimental medications, invasive procedures, including biopsies. Imagine going through all that stress for something that was never a threat. Consider the story of Harold, a 72-year-old former school principal who began forgetting where he placed his reading glasses. His daughter worried he was developing dementia and urged him to get an MRI. The scan revealed non-specific white matter changes, a phrase that sounds scary but is normal in most older adults. That single sentence in the report caused Harold weeks of anxiety. He stopped going to his weekly library group, withdrew from friends, and convinced himself he was losing his mind. But when he underwent a simple cognitive screening, a short paper test that examines memory and attention. His results were perfectly normal. His memory lapses were mild, common, and easily managed with sleep, hydration, brain games, and daily routines. That's why experts say that for seniors with mild forgetfulness, a cognitive test is often far more useful than an MRI. This simple test helps determine whether memory changes are normal aging, stress-related, or something more serious. It avoids radiation, avoids panic, and prevents unnecessary medical spirals. A brain MRI is only recommended when symptoms are severe, such as sudden personality change, seizures, rapid worsening of memory, loss of balance or speech, significant neurological decline. For everyday forgetfulness, the type most people over 70 experience, MRI scans rarely help and often harm. The next test on our list is even more common, and it can send seniors into invasive heart procedures they never needed. The cardiac stress test is one of the most overused tests among seniors. It's almost routine. You mention mild tiredness, occasional chest tightness, or even just slowing down with age, and suddenly you're scheduled for a stress test. On paper, the test seems useful. It monitors your heart while you walk on a treadmill or receive medication that simulates exercise. The goal is to see whether your heart is receiving enough blood during effort. But after age 70, the stress test becomes a double-edged sword. In seniors who don't exhibit classic heart symptoms, this test often does more harm than good. Why? Because the accuracy drops significantly with age. As we grow older, natural changes in the heart and arteries can make the test produce false positives, results that suggest a problem even when the heart is perfectly fine. Studies show that the false alarm rate in adults over 70 can climb to nearly 40%, which means almost half of the people who are told they may have a blockage actually don't. But once a stress test looks suspicious, the medical dominoes begin to fall. More tests, angiograms, dye-based imaging, and sometimes stents or bypass surgeries. All of this can happen even when the patient never needed the test in the first place. A major cardiology review found that a large number of seniors who received stents after stress test referrals experienced no improvement in lifespan, daily function, or energy levels. What they did experience were medical complications: bleeding, reactions to contrast dyes, kidney injury, arrhythmias, and lengthy hospital stays. Here's an example that illustrates this perfectly. Meet Samuel, a 74-year-old grandfather who enjoyed daily walks in the park. During an annual checkup, he casually mentioned that he felt winded walking up hills sometimes. His doctor ordered a stress test, just to be safe. The results were borderline, so Samuel was referred for an angiogram. The angiogram revealed a slightly narrowed artery, not dangerous enough to require intervention, yet a stent was placed anyway. Within 48 hours, Samuel began experiencing kidney problems from the contrast dye. He spent over a week in the hospital and never regained the same confidence in his physical abilities. The original issue: mild dehydration and a bit of age-related fatigue, not heart disease. The truth is, if you are over 70 and not experiencing classic cardiac symptoms, such as chest pain during activity, sudden breathlessness with mild exertion, fainting spells, pressure radiating to the jaw or arm, then a stress test is rarely the right first step. Safer alternatives exist, such as a resting EKG, which checks the electrical activity of the heart without physical stress. There's also the coronary calcium scan, which measures plaque buildup with minimal radiation and far less risk of leading you into the heart procedure pipeline. Stress tests can save lives when used appropriately. But when used on the wrong people, especially healthy seniors, they can initiate a chain of unnecessary interventions. Now let's move to the next test, one that almost every senior has had, yet becomes riskier and less beneficial with age. By the time we reach our 60s, the idea of getting a heart check becomes almost automatic. Many seniors are told, "Let's run a stress test, just to be safe." It sounds reasonable, right? After all, the heart is the engine of the entire body, and nobody wants surprises there. But what most people don't realize is that the standard treadmill stress test, something millions of older adults take every year, was never designed to be a universal screening tool. And yet today, it's used exactly like that. The result? Thousands of perfectly healthy seniors walk away terrified, confused, or pushed toward further unnecessary procedures. Let's break down why this happens so often. A traditional stress test simply measures how the heart behaves under increased physical effort. But for most people over 60, certain things naturally change. Breathing gets heavier, heart rate rises faster, muscles fatigue sooner. None of this is dangerous, it's just normal aging. Unfortunately, the machine doesn't interpret it as normal. It interprets it as abnormal stress response. And that's where the trouble begins. For example, someone who hasn't jogged in 20 years suddenly being asked to walk quickly uphill while wires are attached to their chest is almost guaranteed to produce unusual readings. But instead of acknowledging the obvious, that the body isn't conditioned for sudden, intense effort, the test often flags harmless changes as possible early ischemia or borderline abnormal. Those two words alone are enough to keep someone awake for nights. Worse, a large portion of abnormal stress tests turn out to be false alarms. When seniors are sent for follow-up scans, angiograms, or more intensive imaging, the majority show no significant disease at all. Imagine the emotional roller coaster. One moment you're fine, the next you're told something might be wrong, and after several stressful days, it turns out nothing was serious to begin with. But the follow-up testing isn't harmless. Once you go down that path, you expose yourself to radiation, contrast, dyes, and even potential complications from invasive procedures. Risks you might never have encountered if the stress test hadn't been ordered in the first place. Does this mean nobody should ever get a stress test? Absolutely not. If you're experiencing chest discomfort, sudden shortness of breath, unexplained pain radiating to the jaw or left arm, dizziness that appears during exertion, those are legitimate red flags. In those scenarios, a stress test is a tool that can save a life. But for routine screening without symptoms, that's where caution is essential. The heart isn't a machine that behaves perfectly under pressure at every age. Sometimes it just reflects normal wear and tear. And what you need is clarity, not fear. The key is balance, understanding when testing helps, and when it simply creates unnecessary alarm. Seniors deserve medical decisions guided by reason and individual risk, not by automatic protocols. Your heart is important, but so is your peace of mind. Out of all the tests pushed on people over 60, the full-body CT scan might be the most misleading. On the surface, it sounds like the ultimate safety check. Let's scan everything to make sure nothing dangerous is hiding. The promise of early detection feels comforting, but the reality is far more complicated. And in many cases, it leads seniors into a maze of fear, unnecessary follow-ups, and exposure to risks that often outweigh the benefits. A full-body CT scan isn't a simple picture. It uses concentrated beams of radiation to create detailed images of your internal organs. And here's what most people are never told. The radiation from one full-body CT scan can be hundreds of times higher than a standard chest X-ray. That kind of exposure is not harmless. Repeated scans over time can significantly increase the risk of future health complications. But radiation isn't the only issue. The biggest problem is the incidental findings. CT scans are so detailed that they pick up tiny, harmless things, spots, cysts, nodules, calcium fragments, that millions of healthy seniors have without ever knowing. These things are usually meaningless. They don't grow, don't change, and don't threaten your life. But once they show up on a scan, doctors are obligated to investigate. So a simple scan often leads to more scans, biopsies, repeat imaging, or invasive procedures. Each step increases anxiety, cost, and risk. Yet, the vast majority of these findings turn out to be completely benign. Many seniors look back later and realize the scan created problems that didn't exist in the first place. Another point rarely discussed. Full-body CT scans don't improve lifespan for people with no symptoms. That means if you feel fine, eat reasonably well, stay active, and have no major warning signs, the scan doesn't magically protect you. It only creates the illusion of protection. Does this mean CT scans are bad? No. When used correctly, such as investigating severe abdominal pain, checking for internal injuries, or evaluating serious symptoms, they are one of the most valuable tools modern medicine has, but using them just to look around is where seniors often get caught in a cycle of unnecessary medical intervention. Final thoughts. What seniors truly need. The truth is simple. As we get older, we need smarter healthcare, not more healthcare. Tests should be targeted, not scattered. Helpful, not fear-driven. Personalized, not automatic. You deserve doctors who listen, not just order lists of screenings. You deserve explanations, not panic. Your health decisions should feel empowering, not overwhelming. The goal is not to avoid all medical testing. The goal is to choose the right tests, at the right time, for the right reasons. And the biggest lesson of all? Sometimes the safest path forward isn't adding another scan or procedure. It's understanding your body, trusting your symptoms, and making informed, confident decisions about your health.